Hi, I'm Dr. Brian Lee from Gut Wealth. Today I would like to share one of the most common questions that I get asked in clinic. Can constipation cause back pain? The simple answer to that question is yes, it can. But more importantly, I think we should ask ourselves, is this back pain caused by your constipation? And this is why I've come up with these 6 causes of how constipation can be related to your lower back pain. Causes number 1. Constipation itself can cause back pain. And the reason for that is because if you imagine this is the lower part of your colon called rectum. And as you become more and more constipated, these hard rocks or stool start building up in your rectum, and that stretches the colon wall. The nerve that supplies the colon wall comes from the lower back, and that's how you get this uncomfortable pressure sensation when you're constipated. And obviously, as the rectum expands, it can also press on the surrounding tissues, muscles, which can then cause more pain. Should be a low-grade dull ache. We're not talking about a 10 out of 10 really bad pain here. The treatment is always, number 1, your diet. Make sure you have lots of fibers and water. And the second thing is lifestyle. Make sure you include some exercise before we think about laxative, which is, could be oral medication or medication that goes into the back end. The second cause is Pyelonephritis. Pyelonephritis is a fancy term for infected kidneys. Please ask me the question, how the heck constipation can cause kidney infection? If you imagine this is the rectum again, and in front of it there is a urinary passage called urethra. As the rectum collects more and more feces, it starts pressing onto the urethra at the front. That can then cause or lead to obstruction of your urinary passage, and that means urine is going to be collected in your bladder, and as the urine accumulates in your bladder, it builds up more and more pressure, and that basically pushes the urine back up to the kidneys and cause infection. With pyelonephritis, it is a serious infection. It is a severe condition that usually requires antibiotics, also need a urinary catheter, to basically a plastic tube that goes into the bladder to drain out all the infected urine to make the person better. The third cause is colon cancer. The typical presentation, or the typical way I see it, is a slightly older person who has change of bowel habit for 6 to 12 months, and they then develop back pain over the past few weeks, which is progressively getting worse without an obvious cause to their back pain. When that happens, they certainly need urgent investigation or treatment. That's why I think it is very important to consider seeing your doctor when you develop severe pain, which you might think that is related to your constipation. Now I would like to talk about how back pain can cause constipation. The typical causes is either a neurological condition or injury to your nerve or the spinal cord. If you imagine a trauma that happens to your spinal cord and to your spine, that can sometimes cause paralysis. Don't forget, the nerve supply to the back passage can also be affected, and when that happens, the function of those nerves are not as good as it was before. That's how it causes constipation, because they're not moving the gut properly. And in this situation, we have to rely on more laxative to get the bowel going. And the number 5 is opiates, painkillers. With lower back pain, we tend to prescribe painkillers. Obviously, some of the patients might need slightly stronger pain relief, such as codeine, tramadol, morphine, oxycodone. With these pain reliefs, the side effect is constipation, and that's why we usually co-prescribe laxative with it, so that we can prevent this from happening. The last course is just coincidentally, you can have both conditions at the same time. A chronically constipated person can still injure their back, and that is just very unlucky. However, it is absolutely important to make sure the constipation is treated, because this forms a vicious cycle. Let me walk you through. So, when the person is straining, remember when you open bowels, that requires not just the pelvic floor muscle, it also requires the lower back muscle to help and push the stool out. And the straining motion can cause a lot of pain if you already have lower back pain. So straining causes a lot of pain. More pain means that the person would not want to go to the toilet, and they would rather hold it in even if they want to go. And that causes more constipation, and more constipation lead to more straining when they do open bowels, and more pain. And this basically forms a vicious cycle. And the way to break this cycle is not the opiates. It's not the opiates, okay? It's the laxative. Because when the stool is nice and soft, it will make this whole process easier, and that will reduce the fear of going to the toilet, and then prevent or reduce further constipation in the future. Of course, if you can avoid opiates, then that will also help the constipation as well. If you enjoyed this video, please click the like button below and comment in the comment section. If there's any specific topic you would like me to go through, please let me know, and I will try to cover them in my future videos. If you would like to learn more about constipation, please check out my 10 ways of stopping constipation in the caption section. If you would like to join my channel, please also subscribe. With that said, I hope you enjoyed this videos, and thank you for your time.